common sense struggle.
American, young, old, rich, poor.
I'm Judy Strand, and on behalf of the Commission for Senior Services, I welcome you to this great event, the first ever Oregon White House Conference on Aging. Thank you for being here. I'm really honored to represent the Governor's Commission. It is a vital voice of advocacy for all Oregonians, and I'd like to thank each and every one of you for the ideas that you're going to bring forward today that are going to inform our nation. I also want to make some special acknowledgments of the sponsors and contributors for today's event. Samaritan Health and the Conference Center staff, the Medicaid Long-Term Care Quality and Reimbursement Advisory Council, AARP Oregon, the Oregon Department of Veterans Affairs, the Oregon Association of Area Agencies on Aging, CCTV Salem, Albany Volunteer Caregivers, and our fantastic conference planning committee. I also need to acknowledge Ann McQueen, who staffed this conference, and I would like her to be identified. Where is Ann? Where is she? There she is. So this would not happen without her, and I want all of you to know that. Believe me, we couldn't have done it. So great gratitude there. I wanted to start by acknowledging the fact that many of our cultures, especially our indigenous cultures, value elders in a way that is exemplary, and that many of our immigrant communities that now live in Oregon are showing us that same example. However, I believe that our dominant culture has not yet caught on, and I think that that has prompted a number of comments from a number of aging advocates. One is Gloria Steinem, who said, "At my age, people often ask me if I'm passing the torch. I explain that I'm keeping my torch, thank you very much, and I'm using it to light the torches of others. Because only if each of us has a torch will there be enough light." So in light of all of that, I wanted to think a little bit about what we're focusing on today. In Seattle at the regional conference, which a few of us had a chance to attend, we talked about a lot of important things: economic security, underpaid caregiver staff, absence of culturally specific and culturally responsive aging, lack of mental health services, lack of geriatric specialists, inadequate transportation, all kinds of issues that all of you know better than I do. And all of those are incredibly important. At the same time, we know that in Oregon, we've been a state with some innovative ideas. We've stepped forward in prevention and community-based care and person-centered practice in a very bold way, and I know that we'll do that again today, and that's why we want to hear your voices. I also would like to challenge us to think beyond just looking at the needs one by one and look at the interconnectedness of the needs and what that might bring to our minds in terms of a creative solution for this growing population of older adults. And what if we looked at the ways we can capitalize on the age wave and view that 1 in 5 of us who will be 65 and older by 2030 as a true untapped resource for our community as a whole? A few years back, I was 15, it was 1971, I heard about Maggie Kuhn, who we know started the Grey Panther movement, and she was really of great interest to me at that time, and I wrote her a letter. And of all things, she wrote back to me. I found her letter recently in my family's home when I was cleaning out the home. And in that letter, she encouraged me to be an advocate and fight ageism. She was, for me, one of those lights, one of those torches. And there was something that I'm sure one of you sent me recently that talked about what older adults could be for us in our society. And Maggie Kuhn said that as risk takers, older adults can change the world. They can humanize society. They have 5 roles that she talked about. They are mentors who teach the young, mediators who resolve civil, racial, and intergenerational conflict, monitors of public bodies who serve as watchdogs of City Hall and Congress, mobilizers of social change, and motivators of a society who urge people away from self-interest and toward public good. Our world desperately needs those 5 roles. And think of it. Think of all the conflicts, the intercultural conflicts, the global issues that affect our planet. This is the time to bring our elders into the public square. And I know when I talk about them, the older adults, I'm looking at a room where we understand that they is we, because we want that place when it's our time to humanize and heal the world. And I hope that today we'll come up with some fantastic ways to do that. Okay, so getting to the nitty-gritty, you have these lovely green folders, and as we go forward, they will guide you, and they are color-coded and everything. So in here, you will see the agenda. You'll see a number of pieces of paper on the right. There are issue brief sheets that are color-coded by each issue that we're talking about today, and that will help give you a little background information. And there are some conference evaluations that are purple, and we really would love to have your feedback about how we're doing with this conference today. So I'd now like to introduce Marty Cahill, the Samaritan Lebanon Community Hospital CEO. Since 2013, Marty has been Chief Operations Officer of Samaritan Lebanon Community Hospital and has served as the CEO at Samaritan North Lincoln Hospital and Director of Physician Relations for Samaritan Health Services. We're very thankful for this lovely conference space. So, Marty?
Good morning, everyone, and welcome. This is a great event. Thank you for your participation, and welcome to our event center. We've literally, in the last 2 weeks, opened our hotel. We've got this event center for the last year, so we're starting to utilize it. So let us know how it goes. Give us feedback. We would greatly appreciate that. Again, I'd like to thank you for your participation, the coordinators for this event. I think that your help today will be useful in directing policy and direction for the next 10 years. Some of the things that you're going to be talking about and hearing about today: retirement security, healthy aging, long-term services and supports, and elder justice. And I think together we can all build healthier communities, and I believe that the work here today will be heard back in DC by this summer. So I wish you well. If you have time, there's a jam-packed agenda for you today. But if you can get out and take a look at the garden, there's a Japanese healing garden right next to this facility, nice koi pond. So go out and relax a little bit in between your sessions. Have a good day and welcome. Thank you.
I'd now like to introduce Dani Ledezma from Governor Kate Brown's office. Dani is the governor's Housing and Human Services Policy Advisor, and prior to coming to the governor's office, she served as the Director of Equity, Policy, and Communications at the City of Portland's Housing Bureau. Dani?
Hi, good to see you. Good morning, everyone. On behalf of our Governor, Kate Brown, we'd like to welcome you and thank you for all the work that you're going to do today and that you do every day on behalf of older adults so that to ensure their safety, that they're financially secure, and that their needs are being met. As you know, our communities are stronger, they can thrive when the outcome of the work that you are doing is fulfilled. And as you know, our governor is a strong supporter and champion of the work that you do, and is here to stand shoulder to shoulder with you as we contend with some of the issues that face older adults. So today, as you contend with and discuss and come up with the best and possible ideas around policy change impacting retirement security, healthy aging, elder justice, and long-term supports and services for older Americans, we're really looking forward to the outcome of these conversations that you're having and also how we can support that moving forward. We'd like to thank our hosts that are here, today, all of the keynote speakers and panelists for sharing your wisdom and information with us. And we'd really like to thank the Governor's Commission on Senior Services for your service, your ongoing service and commitment to this issue. We'd like to thank our chair, Judy Strand, and what the governor would like to make sure that you all know is that we're ready to work with you. We've got really strong leaders at the state. Our DHS director, Erinn Kelley-Siel, to work with you, and we look forward to continuing this important work. So thank you.
Thanks, Dani. We now get to hear from Erinn Kelley-Siel, the director of the Oregon Department of Human Services. Erinn started as the director in April of 2011, and she's done a lot of work in safety and protective service and health outcomes for older adults and people with disabilities. And she's been a very strong support to the commission as well, and we're really happy to have her as a leader in our state. So where are you there?
Trying to be quick.
You're being very
Keep
quick.
us on time.
Oops, there
Sorry,
we go.
Judy. Good morning, everyone. All right, come on, Oregon. Let's have some energy here for our federal partners who want to hear from us. This is an amazing opportunity for us here in Oregon. Thank you for that and for bringing the conference here to Lebanon, of all places. Thank you for driving through the farmlands to be here. I'm sure many of you were wondering, as was I, if we were headed in the right direction as we came to this beautiful site, but I'm glad you all made it. It's amazing to think that a conference in Lebanon can sell out in a matter of days, hours, weeks, and that we have a full house, and I'm excited about the energy and insight and intellect that's in the room today, so thank you for being here. In Oregon, we can't help but take pride in all that we've accomplished on behalf of older adults that happen to reside here who decide to come here because of how fantastic a place it is to live. We should be really proud. We had some pioneering efforts that came decades before us, who set the bar really high in terms of a vision for our state around what it should look like to age, both in terms of health and healthy environments and places that we want to be able to live, and also in terms of a long-term care system that supports people to live at home and in community, and with choice and with dignity and with independence. And those are values and a vision that we hold very true and fast in our hearts, and we should. When I go around and I meet with the different staff who do the work on behalf of our agency and on behalf of all of you, I always ask them, so what's going well and what's keeping you up at night? So I thought I would talk about a few things that are relevant to today's discussion that I think are going well here in Oregon, and a couple of things that keep us up at night that we're looking forward to you all having some conversation about today. So what's going well here in Oregon? In terms of the seniors in the state who are low income, it's extraordinary that 87% of them get to remain at home or living in community settings. We can boast of that fact here in Oregon, and we should, because those values that I talked about have really driven a system that supports individual plans for people that allow them to be able to live with dignity, choice, and independence in whatever way is best for them at the right place at the right time. We've accomplished much in that regard, and it's been a lot of hard work, and a lot of you in this room were part of that, and I appreciate it. We also feel good about our third in the nation ranking around several things. I'm going to read them because I won't get them all right unless I do, but affordability, access, choice of setting and provider, support for family caregivers, and effective transitions. That's quite a list, and we're proud to be third in the country. We'd love to be first, though, right? So let's talk about a couple things that keep us up at night that we need to keep working on together. And I will say, others today are here to impart their wisdom upon us. One of the jokes is some of the first people who speak know the least, so I'll just throw that out there for you, but here you go. So one of the things that keeps me up is that women and people of color tend to have the least saved for retirement. And even beyond that, 48% of all Oregonians will rely only on Social Security for their retirement savings. That will afford them to live with about $12,000 a year of income. Oregon ranks in the top 5 states in the country for hunger and food insecurity among older adults. 1 in 3 Oregonians age 65 plus fall every year, with 20 to 30% of those falls resulting in bruises, hip fractures, and traumatic brain injury, which ultimately compromises the ability to live independently. Health disparities among people of color in this state remain stubbornly high, and access to care in rural and frontier Oregon is exceedingly difficult, especially for specialty care like gerontology and mental health. We screened over 35,000 abuse and neglect reports in 2013, And we saw nearly a 40% increase in substantiated abuse involving older adults that live at home or in community settings. Oregon seniors and people with disabilities are estimated to have lost over $11.5 million in savings and equity in 2013 as a result of financial exploitation. We clearly have work to do. That's why you're all here. Just 2 years ago, my grandfather, at the age of 92, passed away in an assisted living facility here in Oregon. He was an amazing individual who greatly influenced my life. He survived abuse as a child, the Great Depression, a mental health challenge that threatened his career as an educator, but he taught me many, many things, many important things, like how to waltz and to polka, how to drive a tractor, how to bake, how to garden. But some of the most important things he taught me were these, and I think you're going to apply them today to the work. People can do anything if they put their minds to it. In my case, around the time of potty training, that looks like this with my grandfather. Papa, I need to go potty. Mind you, I'm not potty trained yet. Well, then why don't you just go? You know where the toilet is. Okay, so I did. My mom says I was potty trained after that. So people can do anything if you put your mind to it. We are put here on this earth not for the good of ourselves, but for the good of others. Hard work pays off. So as you put your minds to some of the most pressing challenges here today of our time, you will be asked to set aside what might be in your own personal best interest for the good of our nation, for the good of all Oregonians. And it's abundantly clear that the hard work that you do will make a difference in the lives of many, many people following the outcome of today and the recommendations, setting the course for the next decades of change and innovation and pioneering spirit that we need to have around some of the challenges we're facing now. So with that in mind, I want to welcome our first keynote speaker, Nora Super, to the dais. She is the executive director of the 2015 White House Conference on Aging. She brings substantive expertise on the issues and experience to help maximize the administration's outreach and engagement with older Americans across the country. Prior to being named executive director, Nora served in a leadership role in the U.S. Department of Health and Human Services Office of the National Coordinator for Health Information Technology. Before joining federal service, Nora served as Director of Federal Government Relations for Health and Long-Term Care at AARP, and prior to that, she represented Kaiser Permanente's 8 regional Permanente medical groups as the Permanente Federation's Director of Public Policy and Government Relations. Nora has more than 20 years of experience working in Washington, D.C. on a wide range of aging policy issues, including healthcare delivery and payment reform, Medicare, Medicaid, long-term care, retirement income security, and other federal and state aging programs. A native of New Orleans, and with family here in Oregon, by the way, Nora studied political science at Tulane University and completed her master's work in public administration with a concentration in health policy at George Washington University. We are thrilled that Nora traveled all the way from D.C. to speak with us this morning. Please join me in welcoming Nora Super.
Let me see if I can get this to work. Okay. Yeah, there we go. Hi, it's great to be in Oregon. Thank you, Erinn, for such a warm introduction. I come into Oregon and I think of land of waterfalls and Subarus, right? So we see that. But I'm thrilled to be here. As Erinn mentioned, I do have family here in Oregon. My brother-in-law and sister are here with me today, and my daughter graduated from Reed last year, and has decided to stay over here on the coast. So it's exciting to have an opportunity to come here and see you all. The United States is experiencing a incredible transformation. As you may know, 10,000 people a day in our country are turning 65. The fastest growing segment of our population are women over the age of 85. So this is just a fundamental shift that we've never experienced. And it's not just because the baby boomers are turning 65, which is a big part of it, but it's the way our structures have changed in terms of we're living longer, much longer than we anticipated when we started programs like Medicare, Medicaid. Older Americans Act programs. And that's good news, that we're healthier, have had medical advances that let us live much longer. But also our family structures have changed. As I mentioned, my daughter lives here in Oregon. I'm in Washington, D.C. She has dreams of going to Latin America someday. So depending on her to take care of me when I'm old and frail is probably not the best way to look forward to my later years. As the speakers mentioned before, the racial and ethnic diversity of our country continues to grow, and especially among older populations as we see more and more immigrant populations come in age. But we expect that by 2050, the older population will be 59% non-Hispanic white, which is 80% today. So all of our ethnic minorities are going to grow in the aging population. And, I was just in Los Angeles last week where there was a great display and we had a wonderful discussion about diversity. But one of the points that we made is the predominant color in our country is really going to be silver in a few years. And so, aging is one thing that all of us experience if we're lucky. And so it's really a thing as a nation that we all need to work on together. This is a nice picture of Lyndon Johnson signing the Older Americans Act. I do want to put a plug in for the Older Americans Act. It hasn't been reauthorized since 2011, sort of a symptom of our polarization in our nation's capital. The number of older Americans continues to grow, so the fact that we can't push through such a vitally important program, as you heard some of the statistics about food insecurity, trying to avoid isolation, many of the very significant programs that the Older Americans Act supports, that we really need your help in making sure that we get this enacted this year and move through Congress. The president's very committed to signing it. We just need to get it over to his desk. So one thing I would mention, though, because of the fact that the Older Americans Act hasn't been reauthorized, any of you been to White House conferences on aging in the past? Have a couple in the room. I've met some people that have been. I actually identified 2 people who were at the very first one in 1961. And we were hoping to get them to Washington to meet with President Obama, which would be great. So there's a lot of history and experience with White House conferences on aging. This one will be different because we don't have direct appropriations, so there won't be a delegate process of, in the past, senators and governors selected delegates to go. Instead, we're really trying to take advantage of communication so people can participate wherever they are. And I think one thing that's also really exciting about this year's conference is the White House has taken a leadership role in ways that they haven't in the past necessarily. Many times White House saw this as something that Congress made them do and went reluctantly. And now we have all aspects of the federal government engaged on this because aging truly does affect so many departments. So we're actively engaged with the Treasury Department, the Department of Labor, Department of Health and Human Services, Housing and Urban Development, just Department of Justice. There are just so many parts of this that we're all working on together, which is really exciting, and we see this momentum going forward. We continue to do outreach efforts. I know many of you were at our Seattle Regional Forum, which was great, so it's great to see you all again. We have a website where people send in comments and we write blogs. We're doing 5 regional forums. So we started in Tampa, we then went to Phoenix, then to Seattle, and then Cleveland. Our last one will be next week in May 28th in Boston. And we have a great, it coincides with Senior Fitness Day, so we're having a great program down by the Charles River with people exercising, which is really awesome. We're looking forward to that. My favorite part of my job is getting out and talking to real people like you. So many times when we're in Washington, sometimes working on things, you forget about who these issues affect and how the programs can help or can be improved. And I would say we've picked up several themes as we've gone around the country, but the overwhelming theme that I hear is that people want to change the way we talk about aging in America, not as this gloom and doom situation of older people that are going to just take away resources, but rather as, some call it like a silver tsunami, and I really don't like that terminology because it seems like a massive wave that's going to overwhelm us. Instead, I like to think of it as a wave that can lift all boats, and as we have all of us together and recognizing this is a fundamental shift in our country, then we can all solve these issues together. The first issue that we've been focusing on is retirement security. Historically, we'd thought about retirement security as a three-legged stool with Social Security, retirement savings, and pensions as the core of that. And so, but our structures and our ways that we work have changed. Most people don't have pensions anymore. Most people don't work for the same employer for 30 years. And so we're finding fewer and fewer people have the resources that they need. The good news is we are living much longer. The bad news is many people are outliving their assets. So trying to figure out how to make sure that people can retire with dignity and have a secure financial foundation is one of our big priorities. Social Security, as you mentioned, is fundamentally important, especially for minority populations, where we see 46% of older African American beneficiaries, 44% of Asian American beneficiaries, and 53% of older Hispanic beneficiaries get at least 90% of their total income from the program. So this is just one thing that we need to make sure, and that's compared to 35% of older white beneficiaries. So the racial disparity in what people have as they age is tremendous. And so we really need to work to strengthen and improve Social Security as we move forward, but also give people more opportunities to save for retirement. As we've shifted from defined contribution to defined benefit plans, some employers don't even offer plans. So 78 million working Americans, that's about half of our working population have no access to employer-provided plan, which is the greatest predictor of whether or not you have any savings. So we're really trying to boost this. The administration is pushing something called the MyRA program. If you've seen it, we're encouraging employers to have enrollment fairs. There's subsidization for employers who get involved in that. We really want people to do that. But even with that, looking at as we live longer and what and how we save for a secure retirement, we need to recognize that health and long-term care needs really can take a big chunk out of your retirement savings. And latest statistics we have show that only 1/3 of Americans 65 and over had over $70,000 in assets. And that's about equal to a one-year stay in a nursing home. So, and if you buy services in your home, of course, those can be as much as $1,800 a month. So making sure that you have enough savings is critically important. Healthy aging is another big theme that we hear a lot and people get very excited about and is wonderful. So we know that while we can't stop the passage of time, if we want to live a longer and healthier life, we know that exercising, eating well, limiting stress provides the foundation for staying healthy throughout life. We're really talking a lot. We look at our healthy aging world in sort of three areas. One is prevention and health screenings, really trying to make sure that people know about the preventive health screenings that are in the Medicare program and take advantage of them. Again, this is something we need to work on with some minority populations who haven't taken advantage of these, and trying to make sure we get those messages out and how to manage chronic conditions as we get older. But we also need to look at housing and transportation. Everywhere I go, the biggest thing I hear is transportation. Like, I just can't get there. Even when I was in Seattle, I went to a wonderful senior center for Asian Americans, and I talked to several of the people that participated, and they told me some of them took 3 buses to get there, and the bus routes always changed. And these were people that were like seeking to get out and do dancing and exercise and socialization with people. We need to find a better way to make this possible for people. It saves us all money in the long run, and keeps people healthy and active and engaged in part of their community. Housing, another huge issue in LA. I'll just mention they're doing some innovative programs. One of our panels, we had a great African-American gay man who lived in West Hollywood, and many of the people there have rent control, but their apartments, they all moved there when they were young, so their apartments aren't situated for them when they were older. So the city's working with them to sort of make some changes and transformation. So critically important to look at these issues, especially with seniors that live alone. And finally, I just want to acknowledge the opportunity to volunteer. The baby boom generation is, they're the people, I'm one, I'm at the very end of the baby boom generation, so I don't count myself as necessarily the civil rights advocate, but certainly a women's rights advocate, and people that brought the peace movement. And it's time we need to re-engage all the baby boomers and say, now it's time to give back. And I hear that all the time. People will say, there should be a Peace Corps for older people. And I say, well, there is. It's called the Peace Corps. But, but there's also great programs, and you'll hear later today from Erinn Tan, who's here and is the director of the Senior Corps program at the Corporation for National and Community Services. And we really want to connect people to opportunities to help us solve these problems in an intergenerational way. We have again, the evidence base that shows that people who volunteer or engage in their communities, they're healthier, they have better outcomes. But then you're also benefiting, older people that are tutoring kids who are at risk, develop great relationships. There's just so many important things that are going on. I'm talking too much, so I'll try to go a little quicker. You mentioned long-term services and supports, which is a huge issue. As we move forward, it's estimated that we'll grow from 12 million people needing long-term services and supports, and by 2050 that need will grow to 27 million. I've heard some estimates that 70% of us will need help with making decisions as we age. And so this is really gonna be all of us. So we need to look at these issues about cognition, how to provide support. Sometimes when people are managing money, that's the first time you see it. So we really need to tell people about some of the warnings and ways to help provide services and supports. Monday, we had a great event at the White House on caregivers. So I just want to say a few things about caregivers. The backbone of our long-term care system is provided by family caregivers, and it is hard work. And we heard from people from all over the country, an older woman who's caring for her husband, who's a Korean War veteran. We also heard from working home care workers as well that are, excuse me, sometimes that sign is a little distracting, but I know I'm on. So let me get back to so the home care, so home care workers, there's a woman there from North Carolina that travels 500 miles per week to take care of people. And these are people that, have dementia, end-of-life care, adults with disabilities that need services, all kinds of needs. She gets paid about $8 an hour, and she doesn't get paid for any of her travel or any of her gas. And, and this isn't atypical. I mean, this is typical, and it shows what our country values. And I think it's find time for us to make sure that people know this is important, hard work, and we need to be paying people a livable wage to provide these services, moving people into these systems, and making sure that people are getting the training. I've gone to many great training programs where the caregivers want to learn. They need to learn about training and ways to better provide services. And the work that they do is so important. So as a nation, we just need to have a call to recognize the importance of this. Thank you. The last issue that I mentioned is elder justice, and this too is sort of a hidden and invisible issue in our country. People don't like to talk about it. One thing that's gotten a lot of people's attention are the financial scams that happen. I go all over the country and someone says, my mom was scammed, my dad was scammed, my grandma was scammed. Sometimes people don't want to admit it, and they've already had their savings wiped out. So we're working with the banking community to look at ways to protect people from that, but also just the abuse and neglect and exploitation that happens. Providing a lot of training out to law enforcement, to our supportive services to make sure people can recognize, and some of it's just training for caregivers. They had an awful case in Montgomery County that was reported in the Washington Post a few weeks ago about a man who was taking care of his mom who she had bed sores so bad that when they got her, they could see her spine through her back. And this was a man who loves his mother. He just didn't know what to do and didn't understand that he needed to turn her, kept some compression socks on for her for a week because he thought it would be too painful to take off. And so we need to provide more supportive services for people and make sure that people receive the training that they need so we can prevent this and bring it out of the secrets within families. It's like domestic abuse and child abuse. We've made tremendous progress, and we really need to take some of those lessons and apply them to elder justice. So I think I'm on the last slide so that people can be assured I'm going to stop. I'm really excited you all are doing this. It's so helpful for us. We did release 4 policy briefs recently, so we encourage you to read them and provide us feedback. We're going to have a report that we issue the day of the conference. I can't tell you the day of the conference yet, but we do have a date, and we plan to announce it soon. But as I tell my family and friends, if I told you, I'd have to kill you, and I think that you like your life, so we'll just have to wait. We do plan to announce it with a bang, so we hope we'll get that information out to all of you all. But we welcome your ideas and input. Want you to follow us on Twitter, and really looking forward to the conversation today and learning more from you all. Thank you so much.
Thank you. That's great. Wonderful.
Thank you. I don't know if
Sorry about my little run.
Oh, no, that's all right.
Thank you so much. Thank you, Erinn, and thank you, Nora. Very helpful viewpoints for us all to think about as we go forward today. I now have the privilege to introduce Bandana Sharesta, who is the AARP Community Engagement Director, a great community advocate that has supported so many of us who do community work with older adults. Bandana?
Thank you, Judy. Well, I have a pretty important role. I have the privilege of introducing Dr. Bill Thomas shortly. But I just wanted to say, 10 years ago, I was just getting ready to accept my job here at AARP in Oregon. And I remember going to the last White House Conference on Aging, and I looked for somebody from Oregon because, looking for delegates from Oregon. And I remember seeing Jim Davis there. So it's wonderful to be here today and to actually have an opportunity as an Oregonian to participate in this White House Conference on Aging. And I think we're very fortunate that we have this forum here because there are only 5 around the country. So our next speaker is Dr. Bill Thomas, who I am so excited is going to be able to speak to us today. Dr. Bill Thomas has built a reputation as one of the most eclectic and creative thinkers in the field of medicine. He's an Ashoka Fellow and winner of the Heinz Award for the Human Condition. Named by Wall Street Journal as one of the top 10 Americans shaping aging, Dr. Thomas co-created the Eden Alternative, an international nonprofit, and the Greenhouse Project. Both organizations model how to revolutionize nursing home care. His synthesis of imagination and action led U.S. News and World Report to name him as one of America's best leaders. In addition to teaching, speaking, and consulting internationally, Dr. Thomas will be visiting 30 cities in 2015 as part of his Age of Disruption tour, including a stop in Portland tomorrow, and I understand it's totally sold out. But I was told by Jay Bloom to let everybody know that if you're interested in still participating, you can watch it online. It'll be live streamed, and you can just Google Age of Disruption, and it'll pop up. Dr. Bill Thomas graduated from the State University of New York and Harvard Medical School, and he lives in Ithaca, New York, with his family. Please help me welcome Dr. Bill Thomas.
Thank you so much. It's nice to be with you. And I thought I'd take the bit of time that I have with you and invest it in a question. The question is, what's gone wrong with our culture's understanding of youth? So often we begin a conversation talking about the problems associated with age. Our culture actually has a nasty addiction to youth. You know, the human appreciation for the young is a universal phenomenon. All around the world and through history, on every continent, human beings have always been attracted to the ephemeral beauty of youth. There's not a darn thing wrong with that. What our culture has done is expanded that appreciation into a nearly mythological, and I would say pathological belief that youth is perfect. You can test this hypothesis by looking at the covers of the magazines, or on the television, or hearing the stories. Our heroes are young. The people we admire the most don't actually exist. They're photoshopped, airbrushed versions of people. We've created a life cycle that goes something like this. We're born and then begin a meteoric rise to perfection. And then we turn 28. And from that point on, the American vision of life goes something like this. And that's not right. It isn't youth that brings us wisdom. It isn't youth that brings us understanding. It isn't youth that teaches us how to love in the midst of the greatest difficulty, to endure amidst the greatest grief. It is age that brings those gifts into our life. In some ways, maybe we need a White House conference on overcoming our addiction to youth. Because the truth is, there's never been a better time in the history of the world to be an old person. I am an old person. Viewed by the standards of human history, I am an old man. And I'm out and proud. I am willing to own my oldness. I'm 55 and I'm old. Oh, yes, I am. If you were to take a picture of me 30 years ago, you'd see I've changed. If you were to take my travel itinerary from 30 years ago, you would quickly discover I no longer take the red eye from the West Coast. I've changed. And the direction of the changes have been good, but my culture tells me they've been bad. This is the fundamental problem that underlies all of our policy difficulties, our political difficulties. We've taken the extraordinary success of human aging and defined it as failure. We've taken the extraordinary accumulation of lived experience, one of the greatest collections of older people ever created in the history of the world, and we have defined them as a failure, as a burden, as a weakness. This is an extraordinary act of cultural vandalism. We have vandalized one of the greatest achievements of human history, that this nation has created a society prosperous enough and peaceful enough to bring forth the greatest flowering of old age in the history of the world, and yet we convene ourselves and concern ourselves with the difficulties and the problems. We should be having a parade down the main thoroughfares of the city of Portland, celebrating our victory. Instead, we find ourselves scrapping and scrabbling for scraps, for little pieces, for incremental improvements. We deserve much more. And not only do we deserve more, we need to give more. Aging endows us with extraordinary gifts of understanding, of compassion, of the 5 M's that we heard earlier. And it is to our shame, and I'm holding up my hand as a member of the baby boom generation, it is to our shame that we have not picked up the mantle of age and draped it across our shoulders and stood forth and said, we will become the elders our society needs. We will surrender our illusory attachment to youth. We will own our age. We will be ourselves, and we will give to others in abundance, because much was given to us. Nearly every person in this room was shaped as a human being by an elder when you were a young person. We're in danger now of creating a society where young people almost never come into contact with elders. It is time for change. It is time for revolution. It is time to disrupt the conventional wisdom surrounding aging, and we are the people to do it, and this is the place to begin. Thank you.
The plan is that each of you is going to take 3.50 minutes to briefly describe the group's issues and recommendations. So I don't care what order we go in. So anybody ready to start? We have elder justice, healthy aging, long-term services and supports, and retirement security, but that one does need to be last. Are you ready, Fred?
Yeah, I'll jump right there.
Okay.
So I am only ready because my group was awesome that I got to work with. So great conversations in our subgroups and where we were at with recommendations. We started off looking at the 2014 Elder Justice Coordinating Council recommendations that came out at the federal level. And somebody brought that to the table. Ellen Clem, not surprisingly, brought that to the table as a starting point for our conversation, just to kind of help us think through what the feds are looking at. With the subgroup conversations and then our ensuing 45-minute full group conversation, I think really what, 3 of the 4 recommendations are things that need to and can be focused. And this is definitely our Oregon recommendation to the feds in the national level, the White House, of what can be accomplished or needs to be accomplished. I mean, all 4 of them are for the national level. And then 3 of the 4 are things that can be looked at internally in states, either whether it's through legislative action, Governor's Commission on Senior Services, or different county and state approaches. So the first one, and this one very specific at the national level, is the need for more national coordination on elder justice issues and elder abuse. There has been recently, just in October, a renaming of an office at the Administration for Community Living. They renamed the Elder Rights Office, the Elder Justice and Adult Protective Services Office. But as Marie Cervantes confirmed for me, or at least as far as she's aware, there's been no communication from that office as far as what national coordination is going to look like. But I think in the national level, I mean, and I'm even aware, I work with that office. It was a first step to rename it to have a central location for issues of elder justice and adult protective services, but I'm aware that at least for the last year or so, they don't have a director of that office. They're in the process of hiring one now, from even what it was named previously. So there's just a lot of work to be done at the national level, and for our purposes, and I need to go back and look at my notes for our full recommendation, but it's the need for the data coordination and collection, the awareness. Just a lot of the research that needs to be done. There needs to be a lot more national coordination. So I'm going to put a lot more meat onto that for the products coming out of today. Secondly, a public awareness campaign, and this is definitely one that can and should be done at the national level and can be done at the state level. And we need to spend a lot more time looking at all abuse types was emphasized in our work group. There was some emphasis in some of the smaller groups on financial exploitation in particular, and because of the costs of financial exploitation, more awareness, more education. But the larger group that we had wanted to make sure that we were emphasizing all abuse types, sexual, physical, emotional, psychological abuse as well. An emphasis we can start moving towards, or we should start moving towards some kind of a marketing campaign. And then as a component of that, enhanced supports for victims, and ideally before people become victims, more supports, more resources, infrastructure. So there's a lot of work to be done around there, and again, a lot more even meat than that on that public awareness recommendation. Third is around law enforcement supports. Actually, I'm realizing there actually was 5. So law enforcement supports reconsiderations. We had some conversation, again, not only at the local level, what better tools can we be providing to our law enforcement to get involved in elder abuse situations that are even arguably, and in some instances, out of the hands of what adult protective services can do. We need more considerations, but definitely at the federal level as well, with the FBI, their Department of Justice at the federal level. So that would be a third recommendation. Fourth recommendation is around fiduciary reforms, fiduciary education, so guardianship, conservatorship, powers of attorney, rep payee. We had some conversations specifically around that. Definitely a recommendation at the federal level with Social Security Administration. And I am aware of some activity in that department with Social Security Administration in a subgroup that I've had the privilege of being a part of in the last 6-8 months. But there's much further to go there. A fifth recommendation specifically around, and this wasn't an initial recommendation out of the subgroups, but in the ensuing conversation of our full group really took form. But more, what I'm kind of framing is community approach supports. Around more not just multidisciplinary teams that do exist at the county levels, but more, this interdisciplinary approach to prevention issues. I would categorize our conversations and there was some conversation around, bringing in community health approaches and entities to have some conversations about how we can better really do the proactive prevention of elder abuse. So I will stop there. I'm probably over my time already. Thank you. Great.
All right. Well, not that it's a competition, but the Healthy Aging people rocked too, and came up with 3 excellent issues. And what they did really well was bundle. We were a bundling group. So I think everyone sees themselves reflected in these. So if we were to look at age-friendly communities, which is also building a community for all ages, it was really clear that this is intergenerational and multi-sectoral approach, but using that age-friendly foundation and infrastructure. Looking to meet the needs of Oregon's diverse communities, really recognizing that a county is a county and no county is alike, that uniqueness that comes to Oregon. And then thinking about what we would need as higher leadership support, and leadership support in general as this movement builds from cities, counties, up to the state, but really having the governor endorse this and see this as a vision and a goal. It's aspirational and inspirational, but we know how to do it and we can do it. There's an infrastructure to follow. So getting that commitment from the governor, potentially having a commission, an age-friendly communities commission or communities for all ages commission, having a policy advisor who focuses on to the governor for healthy aging and age-friendly communities. Really looking for that outreach and that communication strategy. So how do we increase awareness and really have people thinking about the importance and what it means to age well in this state, and starting that early on. And having a very strong commitment to empowerment. It was really important that communities have the ability to mobilize and empower themselves to identify their priorities, but even more so, really honoring the independent living and the importance of people to be able to engage in their own health and make their own decisions and be part of that instead of being told what to do. So that commitment to that authentic communication and to build trust to make that happen. Recognizing that there's a lack of trust out there maybe in some of the service agencies that are providers and those who are the end users. The second issue is looking to an integrated and comprehensive services that are reimbursed by Medicaid and Medicare. So that kind of captures both the problem and the goal and the solution. But really recognizing that mental health, dental health, physical health, and a long list that we came up with, that we get out of our silos and that we come around true patient-centeredness, which would really mean having multiple care providers in contact and working with each other to help successful optimal health happen for our patients and our community members. So moving out of our siloed sectors, looking at interdisciplinary care and learning. So what does that look like from a medical education perspective? How do we train that earlier on? Again, more community awareness. I think that has really come out loud and clear, and I just heard it in the prior session, is that there needs to be a lot more talking and a lot more broad communication strategies to get conversations happening in people's homes. And then more research and understanding what the data can do, collecting more data and doing more research around how we age and causes of disability. And the last issue, while it kind of is part of those other two issues, but was really important that the group didn't want to lose sight of, is just mental health in general for all of us as we age, and how that doesn't get lost, that it's really called out and such a key piece of what we need to do so that it is integrated into our care and that it's not seen as a negative, that people aren't afraid to talk about it. And this was also really important for caregivers and caregiver health and what that means to take care of those who are taking care of us. So that's the high-level summary. Thank you.
Well, our group on long-term care was a group that rocks too. Unfortunately, they had a rock for a facilitator. And I cannot find where our sheets were, which I was going to go to. But there were several things that really did come out. And first was every group picked transportation as one of their issues. And the thing that really came out on transportation was that it isn't simply medical and getting people to a particular service. It's about the social aspect. And the way I like to put it is, we haven't moved that far if we've moved from warehousing seniors to putting them in storage units where they're not connected with the community. And people want to be connected. So we need to do that. And that transportation itself was a socialization aspect for people, as well as a mental health deal in terms of just getting out of their place, and we needed to take it. And of course, funding is you just can't get around it. It's a key issue around transportation. But there also is a need for better coordination of all of the transportation assets within a community. That we need to look at how we have a central hub where you can find information and where the different resources can be used across programs and across ages where possible. And then finally, that there needs to be safety taken into account in terms of it, and talking about public transportation where seniors often don't feel safe within that, but also just training those drivers and stuff to be sensitive to the needs of the individuals that they're working. The other were two around culture. One was culture change, which was spoken up this morning, and that is that we change the concept that aging is an asset, not a problem within our culture, and looking at that. And some of the sort of solutions were things such as age-friendly communities. In other words, don't talk about simply making it accessible for seniors, making it a community that's accessible for people at all ages. We don't need that dichotomy, because things that work for seniors also work for young parents with kids and a stroller or a bicycle or something, that the similar types of concerns are there. And then talking about intergenerational coordination around assets. In other words, building programs where we use the assets of the seniors, which may be wisdom, may be the caring, the knowledge they have, around that of younger people, which may be the physical ability to do things. And looking at how we build that. The one caution was, not all older people want to be around younger people. So recognizing the fact that, this is individual. The other cultural was the whole idea of making our services culturally responsible. And we were lucky enough in our group to have some participants from the deaf culture. And often that is a culture that is ignored when we are looking at serving people. And so they brought some good points about that, that we need to look at each. And once again, it gets around to being person-centered. Each individual is different. But service providers need to be aware of the culture of that person and how that might affect the situation. So there needs to be training around this awareness of cultures and how to deal with. The other thing that came out was still, it's just like transportation. It's been an issue from the beginning. We discussed it the first White House conference that I was at. We're discussing it again. And that is better information on services. That there's still, even with our ADRCs and stuff, our problem. Some of the individuals went to it around deaf services. Most of the deaf services they found on our ADRC or on the website were in New York, not in Oregon. And yet they were aware from their information referral of a lot of services that were available. So we need to go across our various databases and see how we get to them. And then we need to ask, especially our various subpopulations, let's look at the service, our information and referral. Is it working for you? What isn't working? Are you aware of other services and stuff? And let's see, person-centered was the other big thing. And that really crossed a lot of barriers and actually came up around in each of our other discussions. The fact that we need to, one, take into account the cultures of the different individuals. Two, that we need to be training our caregivers, but not just the caregivers, people throughout our spectrum about the various cultures, so that they're even aware that there are issues. And one, I think, interesting one was the whole issue about caregivers. And caregivers following the person from setting to setting. Because one of the big issues for individuals, and I think that's especially the case for people who feel very vulnerable, is the trust building. And so having somebody who you've learned to trust go with you to the next setting to help, maybe not do all the care there, but help you in that setting, is a real key issue to people. So those were the main ones, and we had a lot of ideas, a lot of good ideas, I think, and it's going to be a real experience, I think, for state staff to look at those, because I think there were some very specific types of things that will be helpful.
Thanks, Don.
everyone. Good evening. Okay, so first I'm going to report out on our retirement security breakout, and then I have some closing remarks on behalf of the department. So I'll start with our breakout, which I think was also just an amazing group of people. We came up with quite a few recommendations, and I'm going to try to go really, really fast so that I can tell you what all of them were, because I don't want to leave them out. So the issues that came up most prominently were around Social Security, the adequacy of benefits currently, and then how to expand and protect SSI, and also the retirement and disability programs within Social Security. And then also related is the fiscal health overall of all of those programs. The second issue was the lack of financial education in general, cost of living in general, the issues around family caregiving, and the overall lack of savings and the fact that we need to rebuild the three-legged stool. So our recommendations within Social Security, there were a number of recommendations. So to address the fiscal health of the programs, or at least part of the program, we talked about removing the earnings cap, so on the payroll tax. So you would get rid of that, which would increase the longevity of the program and the sustainability of the trust fund. And then we would increase all benefits, SSI and the retirement and disability side, to at least, and this was the very minimum, was 120% of federal poverty. And then also we had consensus, I'll just say, around all of these recommendations. There were a couple that we didn't reach total consensus on, but these were the consensus of the group. We would use the Consumer Price Index for the elderly to calculate the cost of living adjustment, or the COLA, so that it was a truer reflection of the expenditures for older adults. So their cost of living increase would reflect their expenditures. The second recommendation is around positive media attention about retirement security in general, and that can be done through all different forms of media, but we really thought that that would be something that needs to happen right away. Also, fiscal education and awareness and continuing education, starting in schools and then moving beyond. So throughout the lifespan, we would continue the conversation and the education. And a couple different ways of doing that were recommended. One would be to have an evidence-based pilot that would, be a pilot around education. And it would be a long pilot, because you'd want to measure over a long period of time whether you were successful or not at educating people about retirement security. And then also, it was raised that an intergenerational approach is effective. One of the stories in our group was about how when individuals are younger, maybe they don't understand why some of their earnings essentially are put into a plan that they would use later, and they wanted that in their paycheck immediately. And the older people in the workforce were able to say, no, trust me, you're going to need that. And so having that sort of intergenerational connection about what you need when you're older would be important in educating our youth about retirement security. Then we should address wage inequality. Or eliminate, we came up with a more strong word at the end there that we had consensus around. So eliminate wage inequality. And some of the sub-issues are around gender disparities for people of color. We would address age discrimination or elder discrimination, and then make sure there's increased employment opportunities for older adults. Support the opt-out retirement plan discussed today by Ted Wheeler. Rebuild defined benefit plans and strengthen both defined benefit and defined contribution plans. A couple of ways to do that are to take away incentives that encourage conversion of a defined benefit plan to a defined contribution plan. Make plans a little more portable, like they've done in Canada. Encourage really long-term savings and look at penalties within defined contribution plans to see if they really deter people from cashing out. Because I think in our group there was some indication that, or evidence around the fact that some of those penalties, like the 10% penalty, really doesn't disincentivize people from cashing out, and make sure people understand the value of staying in tax-advantaged plans. Then we would create more innovative ways to save. So thinking about things like an app that would go on your phone and automatically a certain amount of change you might have go straight into a retirement savings plan, as long as there were the appropriate protections in place around the new technology. Address housing. So we endorsed the statement, we had consensus around the statement, housing as a human right in our group. And then also national action around increased revenue, where all entities pay their fair share. And we would look at a new way of budgeting so that we're capturing future savings related to current expenditures and investments. So those were our 10 consensus recommendations. Thank you. Thanks for everyone who participated. So I'm just going to take a couple of minutes. I want to thank all of you on behalf of the Department of Human Services Aging and People with Disabilities program. Our director, Mike McCormick, really wanted to be here to thank you at the end of the day, but because it's legislative session, he did get pulled back to Salem for some legislative responsibilities, but he was here all morning, got to hear all the great panel presentations and our keynote presentations. He really sends his best, and he was really happy to see such a packed room here today. Both Mike and myself, we really look forward to the recommendations from all of these breakout sessions, the panels, the speakers. We want to work with you in an ongoing fashion, and other stakeholders, the legislature, anyone who wants to get involved, so that we continue to be able to have the right types of programs and policies for older adults and people with disabilities in Oregon. And I also want to say thank you so much to Judy Strand and the Governor's Commission, the entire Governor's Commission on Senior Services. So if some of you, I think some of you are still in the room, if you could stand up, I'd like to recognize all of your support. Thank you. So we wouldn't have been able to have an Oregon version of the White House Conference on Aging without the wonderful Governor's Commission. So thank you so much. And last but certainly not least, I want to thank all of our extremely dedicated staff at Aging and People with Disabilities at the state. In particular, Ann McQueen has been our tireless conference planner and advocate. And then she's had all of these other staff and volunteers around to help today. And so if you could all stand up, just want to recognize you and thank you. I think that's all I have. So thanks so much for being here. And I'm going to turn it back to Judy.
Thanks, Ashley. Okay, such a great job. I'm so proud of all of you. And what we're going to do is to work with the facilitators. Staff are going to pull things together and have a tight report that will go to DC. And I'd like to just say, from the commission standpoint, we're going to use these ideas for our state work too, from a commission advocacy perspective. So this is just like a dream come true for us. And in light of that, one of our struggles has always been to get statewide representation to feed ideas to the commission. And so a couple of you suggested that we see who's here from different parts of the state. And I realize some people have left, but could you stand or wave if you're on the I-5 corridor? Okay. Southern Oregon. Yeah. Central Oregon. Okay. Eastern Oregon. Okay, we're going to have to go there for the next. Oh, yeah, there they are in the corner. Okay. And how about the coast? Okay, great. Well, that's really good to know. We'll probably know more from your registration, too, so we can figure that out a little bit. And the other thing I wanted to say is that You'll get the information sent to you there if you gave us your email. So you'll get to see all the recommendations that you just heard. And then these are my notes from Anne. I'm supposed to tell you to wear those buttons. There's buttons on your table, and it says, "Ask me about the White House Conference on Aging," and that's so you can share what we've done. And then also to remind you to do the purple evaluation sheets, please. We need feedback. And if any of you are interested in the tour of the veterans facility that we heard about, there are some people meeting at 4:45, and you can get a tour right away. And then just before we go, I do have something for Anne. Anne needs to come up here. Okay, this has been very hard to hide, but this is thanks to this. So this is from the commission, and we thank you for your incredible work, Anne. Thank you. I mean, I'm telling you, this woman has not had a lot of sleep, so we need to be very kind to her. She's put her all into it, and it wouldn't have happened without her. So, all right, I think we're done, and I feel very inspired. I thank all the speakers, the panelists, the facilitators, the sponsors and contributors, the planning committee, the volunteers, and mostly I thank all of you for being here, and I'm really, really happy with the results. So bye for now. Samaritan Health and the Conference Center staff, the Medicaid Long-Term Care Quality and Reimbursement Advisory Council, AARP Oregon, the Oregon Department of Veterans Affairs, the Oregon Association of Area Agencies on Aging, CCTV Salem, Albany Volunteer Caregivers, and our fantastic conference planning committee.
Roughly $2 million is what our cost is.
Young